Hello everyone, welcome to my division. In previous video, I present detail a shoulder case and challenging to identify a diagnosis based on patient history and assessment. Thank you everyone for participating. Today we will reveal the diagnosis, discuss the differential diagnosis and understand a clinical reasoning behind the final conclusion. So let's begin. Our in previous video the patients presenting a 42-year-old female who's presenting with gradual onset of shoulder pain, progressive stiffness over the several months, difficulty performing overhead activities, difficulty combing hair and dressing, and patient complaint of night pain while sleeping on the affected side. There is no significant history of trauma, but having history of diabetes mellitus. On examination, both active and passive shoulder movements were restricted. The most restricted movements was external rotation followed by abduction and internal rotation. This pattern immediately provides an important clinical clue. The final diagnosis likely adhesive capsulitis, that is also called frozen shoulder. Adhesive capsulitis is characterized by pain and progressive loss of both active and passive shoulder range of motions due to capsular inflammation and fibrosis. It is common affected individuals between 40 to 60 years of age and frequently associated with diabetes mellitus. So question is, why is this correct diagnosis? Let's analyze the evidence. First, we talk the onset of pain is gradual onset. Frozen shoulder typically develops slowly over a week or months rather than a sudden after trauma. The second main experience, the patient experience progressive stiffness. Many shoulder conditions produce pain, but relatively few cases significant restrictions of both active and passive motions. Third, the patient has diabetes. Diabetes is most of the strongest risk factor associated with frozen shoulder. Fourth, both active and passive movements were restricted. This is very important finding because the muscular injury often restrict active movements more than passive movements. Finally, the external rotation was most limited movement. This is considered a classic capsular pattern seen in adhesive capsulitis. There are a lot of differential diagnoses: rotator cuff tendinopathy, subacromial impingement syndrome, glenohumeral osteoarthritis, cervical radiculopathy. So these are a lot of differential diagnoses, but these symptoms and the key features are related with a frozen shoulder case. So if any patients come in OPD with these symptoms, gradually you can do a different type of examinations, proper assessment and special test, and very important is patient history. So in case highlights important combing patients, the combining patient history, clinical examination and movement assessment to arrive the accurate diagnosis. Always remember that clinical reasoning is most important than relying on a single special test. Thank you for watching. If you enjoy the case discussion, don't forget to like, share and subscribe to my division. Thank you.